जी मैम, इस वक्त आपका डेस्कटॉप शेयर हुआ है, आप प्रेजेंटेशन
जी
अपनी
जी
ओपन करिए। मैम आपको एक ऑप्शन भी डिसेबल करना है ऊपर
अच्छा डिसेबल करना है
मोर में डिसेबल
जी मैंने
पार्ट।
कर दिया डिसेबल पार्टिसिपेंट एनोटेशन का
यस मैम, इस पे डिसेबल कर दिए उसको प्लीज।
जी मैंने इसको डिसेबल कर दिया, थैंक यू।
ओके।
आई थिंक वी कैन स्टार्ट नाउ 11:47।
यस यस मैम, स्टार्ट कर सकते हैं। ओके।
Okay, Bismillahirrahmanirrahim. This is the third lecture. I have repeated this slide. Okay, this is the basic structure of the liver. The point of repeating over here is that this is the basic functional structure of liver. Okay, so this is central vein, and over here is the portal tract, which is shown here as well. So we have talked about that most of the injuries depend why these zones are important, like the injuries which are associated with the drugs mostly affect this zone 3. ठीक है, zone 3 को क्यों affect करेंगे? क्योंकि maximum जो drainage होता है, जो maximum blood supply होती है, that is to this central vein. So that is why like in ischemic injuries, this zone 3 is the first zone to be affected, followed by the zone 2 and then zone 1. While the vice versa happens in cases of say viral hepatitis or autoimmune hepatitis, where the injury starts from portal tract. Okay, so why this functional structure is important, because like the injuries which are associated with the drugs, which are associated with ischemia, usually starts from zone 3. Okay, why from zone 3? Because here is the central vein or sare metabolites. Drug injuries, why the drug injuries are common are associated with the liver damage? Because liver is one of the organs which used to do the metabolism of all the drugs and toxins. Okay, but you have to keep in mind that the drug injuries, ischemic injuries, starts from the zone 3, which is closest to the central vein, while the injuries which are associated with the infectious hepatitis and autoimmune, they usually start from the area of the biliary tract, that is they go from zone 1 to 3. Okay, so that is why the biopsy is important. So before starting autoimmune hepatitis, I briefly want to review infectious hepatitis just with the 2 slides. The reason being that this topic is one of the most important topics, commonly asked, commonly encountered by you as you guys are working, start working. So I have asked few questions in the previous lecture and I come across it probably the concept is not either fully or fairly communicated by me and got by you, or but definitely your effort is required. Okay, so पहली तो बात ये बात समझ ले, when I asked the question कि hepatitis B कैसे diagnose होगा, तो जैसे IgM diagnose होगी, ठीक है, या IgM detect होगी. So okay, the answer should not be like this. Just understand that there are 2 antibodies. One is the IgM and the other one is the IgG. IgM antibody is the first antibody to come to appear in the serum as the infection starts. Okay, and followed by IgG. Keep in mind that the presence of IgG signifies that the acute infection has recovered and the patient has developed immunity. I again repeat, there are total antibody, it includes both IgM and IgG. The presence of IgM indicates that the infection has occurred. The presence of IgG indicates that that infection has occurred and patient's body has get out of that infection. So and there is rise in the level of IgG. Please, this is the basic concept from the immune chapter. So if there is any confusion, you can ask me at the end, but that need to be confused. ठीक है, तो मैंने आपको basically I have shared this in the first lecture. ठीक है, पहले एक एंटीबॉडी आई, अब ये एंटीबॉडी कौन सी होगी? IgM. This is followed by another antibody which is IgG, and this in figure 4 the patient has come out of the infection. Please be clear about it. First, IgM indicates that infection has occurred. Then IgG will indicate that the patient has come out of the infection. अब this briefly this graph, ठीक है, जो मैंने पूछा था आपसे, but I come across कि भाई ज़्यादातर लोगों की समझ में नहीं आया. ठीक है, in the end हम दोबारा पूछ सकते हैं. मैं 5 मिनट से ज़्यादा नहीं लूँगी अभी, but we can do it. We can do the same exercise again. So again, this is the picture from Robbins. Nothing new about it. I have copy pasted from the previous lecture. इसमें भी कोई नई चीज नहीं है. Okay, so basically दोबारा मैं repeat करती हूँ ये दो ग्राफ क्यों है? There are two graphs, the A and B. The graph A is of a patient in which the hepatitis B develops, and then and he has come out of the infection successfully. The figure B, the graph B, is of a patient who has acquired hepatitis B and then they enter into the chronic phase. Okay, I simply repeat it again. What is graph A? The graph A is from a patient who has developed infection and come out of it. And the other one is that who has developed chronic hepatitis. Again, the first stage, when the patient becomes symptomatic. How we come to know that patient has become symptomatic? Jaundice is there, which is the hallmark of the liver disease. Patients में symptoms develop हुए, jaundice develop हुआ. आप clinic में बैठे हुए, the patient has come to you. आपने serum transaminases कराए. Serum transaminases क्या है? जब आप LFTs करवाते हैं, उसमें जो ALT, AST होता है, that is the serum transaminases. आप clinic में बैठे हैं, आपने LFT करवाए, ALT और AST raised आया. अब आपने देखना है hepatitis B है, C है, या क्या हो रहा है. आप कौन सा टेस्ट कराएंगे एक सिम्प्टोमेटिक पेशेंट में ये चेक करने के लिए कि इसको हेपेटाइटिस बी सरफेस हुआ है या नहीं हुआ है? कौन सा टेस्ट करवाएंगे? हम करवाएंगे हेपेटाइटिस बी सरफेस एंटीजन. दिस इज द टेस्ट व्हिच इज बीइंग डन इन द मेजॉरिटी ऑफ द laboratories. Okay, but if I ask the question, okay, hepatitis B, so you did hepatitis B surface antigen is found to be raised as shown by the graph as well. But what are the other possible markers which can be elevated? So the other possible markers which can be elevated by are hepatitis B E antigen and hepatitis B virus DNA. So basically the presence of these three antigens, that is hepatitis B surface antigen, hepatitis B virus DNA and hepatitis B antigen, all these indicate that the acute infection has occurred and the patient and there is viral replication. ठीक है, इसको quickly अगर हम compare करें from the other graph, जहाँ पे acute infection है तो आप ये देख रहे हैं कि ये viral replication is continued. ठीक है, पूरा continue हो रही है viral replication. जबकि यहाँ पे क्या हुआ, जहाँ पे patient को acute infection हुआ, symptomatic हुआ, ये तीन antigens positive आए. ये peak आई, ठीक है, peak आई और उसके बाद patient has the immune system of the patient's body is activated, and what we can see over here is, sorry, what we can see over here is there is rise in the IgM anti-hepatitis B4 antibody. ठीक है, ये किसमें क्या पहली एंटीबॉडी जो इंक्रीज होनी शुरू हो जाएगी अगर if the patient has started recovering, that is the 4 antibody. जो एक बहुत कॉमनली आस्क्ड क्वेश्चन होता है कि जो विंडो पीरियड है, विंडो पीरियड क्या होता है कि जब सरफेस एंटीजन डिसअपीयर हो गया है बट सरफेस एंटीबॉडी हैज नॉट येट अपीयर इन द सीरम. सो वो जो कोर पीरियड होता है, इन दैट कोर पीरियड which antibody which is the first antibody to appear in the serum? This is the anti-IgM anti-hepatitis B4 antibody. Please, if there is confusion, you can ask me. Then what happens? As you come to the graph, there is rise in the anti-hepatitis B E antibody as well. Okay, and finally these three antibodies goes down, and the antibody appear finally is anti-hepatitis B surface antibody. अगर हमने ये स्टेटस चेक करना है, जैसे अगर कि मैं मेडिकल कॉलेज में या आप मेडिकल कॉलेज में एडमिशन ले रहे हैं और आपको इम्यूनाइजेशन की जरूरत है या नहीं है, तो आपकी सीरम में क्या चीज चेक की जाएगी? एंटी हेपेटाइटिस बी surface antibody. Okay, और what this total is कि finally क्या होने लगता है कि IgM disappear होने लगेगी और IgM की बजाय कौन सी core antibody आ जाएगी in the serum? It is IgG. So in the labs, basically the IgG estimation is not available. So instead of IgG estimation, we usually do total. We check this total anti-hepatitis B core antibody, and we know that the patient is recovering. So basically, if it is in rising, we assume it that it is basically IgG which is rising, or we take both IgM, IgG, and then subtract them. So that is a pretty difficult to understand, but once you concentrate, it is able to this is able to understand. Like you will be able. Now you compare it with this graph. ठीक है, यहाँ पे क्या हो रहा है कि ये तीन markers, which are the indicators of active viral replication, that is hepatitis B surface antigen, hepatitis B virus DNA, hepatitis B, these keep on rising. ठीक है, इनके बार straight है, इसका मतलब है कि इनकी replication हो रही है. If you compare it over here, they have stopped. It means there is no viral replication. But once the patient is entering into chronic hepatitis, these bars continue, means that the viral replication is still going on. And if you compare IgM anti-hepatitis B core antibody, that it rises and then it falls, and then even the anti-hepatitis B antibody does not appear in the serum. And what is missing over here? The surface antibody, which finally decides that the patient has come out of the infection. Almost never appears in the patient where the chronic disease develop. Okay, if you compare these two, you can see this surface antibody is not over here. It means that patient has not come out of the disease. Okay, I'm just stopping here over here, and in the end, I will ask questions so that I come across, so that I'll come to know that either you guys understand this or not. Okay, so coming to topic, which is the topic of the today, it is autoimmune hepatitis. In this, the main heading, the main title of this today's lecture was immune mediated hepatitis. So basically, in the Robbins, it is given like this: that first they have discussed autoimmune hepatitis, then drug-induced alcohol, and in the end, with the major bile ducts, they have discussed the uh, primary biliary cirrhosis and cholangitis. But uh, I am discussing autoimmune hepatitis, primary biliary cirrhosis, and primary cholangitis over here, because actually, when you talk conceptually, these are all immune-mediated disorders. अच्छा, अब autoimmune hepatitis का मैं आपको बता दूं कि autoimmune hepatitis is a pretty difficult topic again, लेकिन इसमें कुछ आपको basic antibodies वगैरह के नाम पता होने चाहिए, because that can be asked. Okay, so autoimmune hepatitis क्या होता है? Autoimmune hepatitis is a chronic and progressive hepatitis of unknown etiology. तो क्या होता है? Chronic होता है और प्रोग्रेसिव होता है, यानी पहले आपको एक्यूट के सिम्टम्स डेवलप होंगे और आहिस्ता आहिस्ता इट विल लीड टू chronic hepatitis. So chronic hepatitis in patients with the immune abnormalities. इससे पहले हम ये स्लाइड करते हैं. जब हम कहते हैं कि कोई autoimmune hepatitis है, ठीक है, तो autoimmune hepatitis में basically it is like any other immune mediated disease of the body. जब भी हम कोई और immune mediated disease कहते हैं, उसमें ज्यादा triggering factors क्या होते हैं? किसी भी autoimmune disease में उसके triggering factors होते हैं कि कोई toxins हैं, कोई drugs हैं, या viral infections हैं. So basically any of them can lead to the initiation of the immune mediated thing. Then autoantigens, like some of the antigens of the human body are more prone in some individuals than in the others. Then there are few changes in the HLA types, and then the slight difference in the immune regulatory system. So by looking at this slide, we can say that autoimmune hepatitis is like any other hepatitis. Is like any other immune disease in which the etiology is basically the combination of all these three. इसके triggering factors क्या होंगे? जब भी हम immune mediated disorders body में पढ़ते हैं, उनके triggering factors क्या होते हैं? उनके triggering factors होते हैं either the toxins, drugs, or viral infections. Some autoantigens are slightly different, so that can lead to that can lead to the initiation of the disease. उसी तरह कुछ genetic factors हैं which predispose a difference in the HLA typing, which predispose some of the individuals to these infections, and then immune regulatory mechanisms. Now coming back to this slide, this is a chronic hepatitis in patients with the immunological abnormalities. As we know that all autoimmune diseases are common in females, the same is true for autoimmune hepatitis, that it is more common in females. और इसको हम डायग्नोज करते जो डायग्नोस्टिक अभी चले आगे डिस्कस करते हैं। जो चीज आपने यहाँ पे मैं आपको 4 पॉइंट बताऊं, क्योंकि अगर हर चीज आप करेंगे, जो चीजें आपको ऑटोइम्यून हेपेटाइटिस की पता होनी चाहिए कि देयर आर बेसिकली 2 टाइप्स ऑफ ऑटोइम्यून हेपेटाइटिस, टाइप 1 एंड टाइप 2, डिपेंडिंग ऑन द प्रेजेंस ऑफ antibodies. So basically the anti-LKM antibodies are present in type 2 hepatitis. Whenever we talk about autoimmune diseases, if patient has one type of the autoimmune disease, then automatically to nahi, matlab naturally he is prone to develop other autoimmune diseases, like he's prone to develop thyroiditis, he's prone to develop Sjögren's syndrome and ulcerative colitis. So when I'm skipping, when I would have liked to ask Sjögren's syndrome, we have already done this in the at the beginning of this lecture. So morphologically, the morphological features are very much similar to viral hepatitis, but there is predominance of lymphocytes and plasma cells. So there are triggering factors. Virals ho sakte hain, autoantigens are slightly different, and then it is some genetic and immune regulatory mechanisms. So basically, there is interferon gamma produced by the CD4 and CD8 cells, and it is basically the overactivity of CD8 T cell mediated cytotoxicity which causes injury. So injurious agents कौन-कौन से हो सकते हैं? Viral infection, certain drugs, and other autoimmune disorders. The patient is prone to develop other autoimmune disorders. So diagnostic algorithm. The diagnostic algorithm होता है patient is ये एक point scoring system है, which is the table is given in Robbins के point scoring system है. उस point scoring system को कोई ये नहीं आपसे expect करेगा कि आपको point scoring system याद हो, लेकिन सिर्फ आपको उसके at least पता हो कि क्या-क्या चीजें देखते हैं. Elevated AST, gamma globulin levels, जिनका level, जिनका ratio जो है more than 3 होगा. Then in the serum, we have to exclude other viral hepatitis, like hepatitis B surface antigen हम कराएंगे, hepatitis B, hepatitis B को exclude करने के लिए, then hepatitis B, then surface anti-hepatitis C surface antibody करवाएंगे to exclude hepatitis C, A, and similarly the hepatitis E. So all other type of the viral infections are excluded. Normal or near normal iron hoga to exclude the hemochromatosis, which is another metabolic disorder. Alpha-1 antitrypsin, anti-mitochondrial antibody is negative, which is positive in primary biliary cirrhosis, and certain plasmin levels are normal. So basically, all these tests are done to exclude other causes of hepatitis. और liver biopsy भी हमें क्या मिलेगा? Interface hepatitis and lobular plus minus lobular hepatitis. The disease may be indolent or severe. Basically, viral hepatitis when there is initiation of the viral hepatitis is usually slow in onset as compared to it. Autoimmune hepatitis may have more of the cases of autoimmune hepatitis have acute presentation. There is a female preponderance in young and perimenopausal patient. The entire histological spectrum of the chronic hepatitis can be seen in cases of autoimmune hepatitis. But what is important is that there is predominance of lymphocytes and plasma cells. Why there is a predominance of lymphocytes and plasma cells? Because the plasma cells are the cells which are responsible in the body for basically producing antibodies. ठीक है? Body में antibodies कहाँ से produce होती है? By which cell? Plasma cells. So there is predominance of plasma cells. इसलिए अगर आपको morphology लिखने के लिए आती है तो आप उसमें chronic hepatitis की morphology basically लिख देंगे और साथ लिख देंगे कि there is predominance of lymphocytes and plasma cells. Once you have written this line that there are morphological features of chronic hepatitis, that is inflammation, interface hepatitis, and then predominance of lymphocytes and plasma cells, you will get good marks, because when we come across के आपको ये बात पता है कि this is antibody mediated process, so there is predominance of plasma cells. The clusters of plasma cells in the interface of portal tracts and hepatic lobules is fairly enough for the diagnosis of autoimmune hepatitis. ठीक है? तो morphology में अगर आप मुझसे पूछिए कि आपको कौन सी चीज याद करनी होंगे, 2 words, interface hepatitis, and presence of lymphocytes and plasma cells. Okay. So basically, if you look over here, these are the liver cells with abundant lot of eosinophilic cytoplasm. And over here, although I don't expect you to identify the plasma cell, but you can. This is the plasma cell with eccentric nucleus. This is the plasma cell. This is the plasma cell. So this is liver, and over here the liver tissue is infiltrated by these inflammatory cells, which are those lymphocytes. इसमें lymphocytes कौन से? ये lymphocyte है, ये lymphocytes है. This is a lymphocyte. This is a lymphocyte, but there are a lot of plasma cells. This is a plasma cell. 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 So if you get this photomicrograph, say in OSPI, you must have a history. You must have a history like this is a female patient who has presented with the chronic hepatitis, and the serum levels of anti-nuclear antibody are and anti-smooth muscle are elevated along with anti-LKM. Now, which morphological features you can appreciate is by looking at the scenario, you will come to know that this is a case of probably autoimmune hepatitis, and then you can say, okay, this is a plasma cell, this is a plasma cell. Okay, but if you even ask me that this is a photomicrograph, can you give the your histopathology report that this is autoimmune hepatitis without any serum marker? Answer is no. I am doing histopathology for last 15 years. If you say ये तस्वीर आप इसमें बताएंगे, is it autoimmune hepatitis? The answer is no, I cannot tell unless you provide with me the clinical history and the biological markers. Then on this photomicrograph I can say. So don't worry, you won't get the photomicrographs without doing the scenario. Always there's a clue in the scenario, but the clue can only be picked if you have have an idea that what antibodies you can have in the serum. Okay, so mortality of the severe untreated hepatitis is approximately 40% within 6 months. Cirrhosis develop in 40% of the survivors. जब भी कोई autoimmune hepatitis, जब भी कोई autoimmune disease होती है, उसके बारे में कोई भी किसी भी autoimmune disease के बारे में what is common? The thing which is common about autoimmune diseases, lastly there is firstly there is multifactorial etiology. मल्टीफैक्टोरियल इटियोलॉजी का क्या मतलब होता है कि उसकी इटियोलॉजी में कि क्या चीजें जो ऑटो इम्यून प्रोसेस को ट्रिगर कर रही है. दिस कुड बी वायरल इन्फेक्शंस, दिस कुड बी टॉक्सिन्स एक्सेट्रा. उसके बाद नाउ कम टू द पॉइंट कि वो किसमें कॉमन होता है? फीमेल्स में कॉमन होता है. उनमें क्या चीजें होती है? मोस्ट ऑफ द इफ द पेशेंट हैज वन autoimmune disease, he has a predisposition to develop another autoimmune disease. इसी तरह the autoimmune diseases in the body, any autoimmune disease किससे treat होती है? With the immunosuppression. और immunosuppression में क्या चीज यूज होती है? prednisolone यूज होती है और azathioprine. ठीक है. So ये this is common for any disease. अगर immunosuppressive cyclosporins etc यूज हो सकती है. Once the end stage liver disease is developed, then the only chance is then the treatment is liver transplantation. And but even after transplantation, the disease can recur in 22 to 42%. Okay. So basically, there are two types of autoimmune hepatitis: the type A, the type 1 and the type 2. Type A usually develop in female with middle age, and the type 2 hepatitis develop in children and teenagers. Type 1 hepatitis में आपके पास कौन सी एंटीबॉडीज होंगी? एंटी स्मूथ मसल एंटीबॉडी, एंटी न्यूक्लियर एंटीबॉडी. उसके अलावा जो है और आपके पास टाइप 2 में कौन सी होंगी? एंटी एलकेएम, दैट इज एंटी माइक्रोसोमल लिवर किडनी एंटीबॉडीज. Okay, so these you should know these antibodies whenever you get this scenario of this thing. It has always come with the clue of the antibodies. So the other topic is the drug and toxin induced liver injury. The drug and toxic induced liver injury is very important for the liver. Why? Because the liver is one of the organ where most of the metabolism, most of the breakdown of the toxins and drugs is taking place. लेकिन what are the different ways? Drug toxicity को इससे ज़्यादा डिटेल में करने की जरूरत नहीं. मैं सिर्फ आपको जो 2-3 पॉइंट बताऊंगी वो कर लें. What are the different ways in which drugs can be toxic to the liver? either there is direct toxicity to the hepatocytes and biliary epithelial cells. ठीक है, drugs खुद ही directly cytotoxic है, और hepatic conversion to xenobiotic to active toxin. ठीक है, कि hepatic conversion हुई है. This is the one drug which each of you know how it affects the liver is acetaminophen, because acetaminophen is a drug which is most commonly responsible for the liver damage. And how it does so, it is by this mechanism, that is hepatic conversion. The liver system is cytochrome P40, sorry, P50. It convert it into a metabolite which is toxic to the liver cells. And acetaminophen, the overdose of acetaminophen, and if it is taken with the suicidal objective, it is liver toxic and causes acute permanent liver failure. So one drug which each of you should know, the table is given in the Robbins. You can go through the if someone want to go through those drugs, you should go through them. But one drug which all of you should know is acetaminophen. And how the acetaminophen is liver toxic is by the conversion inside the liver to an active metabolite. The other is the immune mechanism. और immune mechanism कैसे होता है कि drug itself act करती है as bind to a liver cell and act as a heparin, यानी वो normal cell के साथ bind हो जाती है और body उसको sense करती है as foreign antigen or start immunity of the body or say autoimmunity of the body, and that is called immune mechanism. So basically, quickly, there are three mechanisms by which the drugs causes liver toxicity: direct toxicity, hepatic conversion, and immune mechanism. The drug reactions could be predictable. ये बहुत सारी drugs हैं जिनके बारे में it's already known. Like some of the antituberculous, it's already known that they are liver toxic. Like for acetaminophen, we know that it is liver toxic. But in some of the cases, it is unpredictable. एक drug generally it is not cytotoxic for you, it is not hepatotoxic for you, but it may be hepatotoxic for needs. So उसको कहते हैं unpredictable or idiosyncratic reactions. Drug-induced chronic hepatitis is clinically, histologically distinguishable, is indistinguishable from the viral hepatitis. और how to diagnose? कि अगर आप मुझे अगेन एक स्लाइड दे देंगे और कहेंगे कि इसको देख के बताएं कि इसमें ये लिवर ये ड्रग इंजरी से हुई है, yeah, what is the diagnosis? I will say my answer is no. You have to exclude by doing the serum markers of hepatitis B, autoimmune hepatitis, other causes, and then I can diagnose it. But what is good about the liver toxicity is, by the drug toxicity is, once the drug is withdrawn, most of the liver recovers from that. इसके अलावा एक बात हमेशा याद रखें कि जब हम hepatotoxicity from the drug or toxin suspect कर रहे होते हैं, आप हमेशा पूछते हैं कि आप कीमो से कोई दवाई तो नहीं ले रहे, आप कोई होम्योपैथिक की मेडिसिन तो नहीं ले रहे. तो जो होम्योपैथिक की मेडिसिन होती हैं, जो या कीमो की दवाई होती हैं, they are known to be liver toxic. But basically there is no need to go in very much of detail. और एक और चीज ये ध्यान में रखिए कि every morphological feature, okay, I again repeat, every morphological feature with hepatitis cause can be seen with the drug. So basically the drug-induced liver disease is a diagnosis of exclusion. You take history, you check serum markers, and then you can diagnose it. और एक drug जो याद रखनी है, acetaminophen, and how it is liver toxic. Basically, the drug itself is not liver toxic. It is a conversion of this drug by cytochrome P50 into an active metabolite, which is hepatotoxic. So basically, this is a table from Robbins, and just to give you a view, not to so that I expect कि आपको सारी drugs याद हो, लेकिन you can see that cholestatic hepatitis, cholestasis, hepatic necrosis, fatty change, granuloma. So drugs can cause any morphological pattern. So basically, it is a clinical diagnosis, the presence of the depending on the history that patient is taken. Few drugs like phenothiazines, thiazines, ethanol. Okay, alcohol is another toxin. We will talk about it later on. There is no need to do it right now. Okay, so basically now primary biliary cirrhosis. Okay, primary biliary cirrhosis and primary sclerosing cholangitis. The primary biliary cirrhosis and primary sclerosing cholangitis. These are the two processes which are immune mediated and affect the bile ducts. ठीक है, अभी मैंने स्मॉल लार्ज मीडियम कुछ नहीं कहा, मैंने कहा क्या चीजें, प्राइमरी बिलियरी सिरोसिस, प्राइमरी स्क्लेरोसिंग कोलेंजाइटिस. These are the two processes which affect the bile ducts. ठीक है, अब जो भी disease bile ducts को affect करती है उसमें we don't expect rise in the AST and ALT which are transaminases. We expect the rise in which two markers, that is alkaline phosphatase and gamma glutamyl transferase. Okay, जब भी bile ducts को damage होगा, जब भी whenever there is a damage to the bile ducts, whenever there is obstruction of the bile duct, which two markers are elevated? Alkaline phosphatase and gamma glutamyl transferase. The one antibody which you find to be raised in anti-mitochondrial antibody. These antibodies you need to learn their names. Okay, with the right scenario, these are frequently asked. Believe me, in undergraduate exams, in your FCPS, in your lab, in your steps, you need to know it. Okay, so what happened over here is damage to the interlobular. Basically, there's in primary biliary cirrhosis, there is damage to the small and medium-sized bile ducts, intrahepatic hoti hai, and it can cause granulomatous inflammation. It is associated with other autoimmune disorders. Okay, don't need to say again and again कि किसी को एक autoimmune disease है, so there is a propensity, there is a predisposition for that individual to develop another autoimmune disease. Okay, so the notable point over here is that granulomas are there on the biopsy, unable to excrete bile, therefore present with a malabsorption of the fat, and evidence of the portal hypertension will be there. ठीक है, जो हमने पढ़ा था कि what are the causes of portal hypertension? One is obstruction of the portal vein. Sorry, one is the obstruction of the portal vein. So patients can present with the portal hypertension. Present with the lethargy, itching क्यों होगी? क्योंकि again obstruction हो गई, bile acids accumulate होंगे, increase in alkaline phosphatase and also gamma glutamyl transferase. We have hyperlipidemias. Consider any patient of autoimmune disease presenting with the liver disease. Primary sclerosing cholangitis is another immune-mediated disease. Again, affect the bile ducts, but it affect the medium size and large bile ducts. So it is associated with, has a strong association with ulcerative colitis and also with HIV. Inflammation, fibrosis, or strictures okay on the biliary tree. Or please remember this term, especially when you go for PLAB and steps and FCPS part 1. They give a very characteristic scenario that there is a patient of 30 years of the age and ERCP is done, and on ERCP there is beaded biliary tree. अगर कहीं पे beaded biliary tree का आपको clue दे दिया है, the diagnosis is primary sclerosing cholangitis. जब भी आपके पास scenarios आते हैं तो क्या होता है कि 10 लाइन का scenario होता है. Those who have gone through the MCQs which are asked in these 10 लाइन का scenario होता है. ठीक है, वो सिनेरियो क्यों दिया गया होता है? जस्ट टू टेक अवे योर टाइम. आपने वंस ये देखा कि beaded biliary tree आपको कहा है ERCP पे, beaded biliary tree क्यों डेवलप हो रहा है? क्योंकि फाइब्रोसिस हो रही होती है biliary tree में. Once there is appearance of this beaded biliary tree, the answer is straight away primary sclerosing cholangitis. Okay, so there is chronic biliary obstruction that lead to cirrhosis. Asymptomatic होता है, again high alkaline phosphatase. ठीक है, अगर मैं कह दूं कि एक पेशेंट है जिसका अल्कलाइन फॉस्फेटेज इंक्रीज है और उसमें gamma glutamyl transferase इंक्रीजेस है, आप मुझे बताइए कौन सी डिजीज है? तो यू शुड कम अप विद आंसर कि मैडम हम आपको ये तो नहीं बता सकते कौन सी डिजीज है, बट व्हाट वी कैन टेल यू इज दैट समथिंग इज रॉन्ग विद द biliary tree. There is obstruction in the biliary tree. Either there is obstruction in the biliary tree by a tumor, by a stone, or an autoimmune process is going on. ठीक है, ये ट्रिकी क्वेश्चन है जो आपको बताएंगे आपके कि नहीं हमें आंसर नहीं बता सकते. आप मुझे बताएंगे इसकी एंटी माइटोकॉन्ड्रियल एंटीबॉडी रेज्ड है या नहीं. अगर एंटी माइटोकॉन्ड्रियल एंटीबॉडी रेज्ड है तो आंसर इज प्राइमरी biliary cirrhosis. अगर beaded appearance है ऑन ERCP तो आंसर इज प्राइमरी sclerosing cholangitis. ठीक है, ये रेयर डिजीजेस हैं लेकिन इनकी कुछ रेडियोलॉजिकल और कुछ हिस्टोपैथोलॉजिकल चीजें इतनी कैरेक्टरिस्टिक होती हैं कि these are all but in the right scenario. So you can have your extra score over here. High bilirubin, alkaline phosphate, but negative for anti-mitochondrial antibody. Anti-mitochondrial antibody आपको याद करनी पड़ेगी. Steroids देते हैं. तो उसके बाद थोड़ा सा यहाँ पे याद रखिए कि primary sclerosing cholangitis में और इसमें ये cholestyramine और urodeoxycholic acid देते हैं to treat pruritus and treat cholestasis. Liver transplant as is the treatment like for any other end-stage liver disease. is or primary sclerosing, and एक और notable point इसमें क्या है कि primary sclerosing cholangitis की strong association है with ulcerative colitis. So basically, again, this table is here. I know that I'm running out of time. अब इसमें serology पे please primary biliary cirrhosis में anti mitochondrial antibody raised होगी, anti nuclear antibody raised होगी, anti nuclear cytoplasmic antibody raised होगी. Otherwise, on the other side, anti mitochondrial antibodies only 0 to 5%. So this is diagnostic. Primary sclerosing cholangitis has strong association with IBD ulcerative colitis, which is missing over here. Radiology पे primary biliary cirrhosis में radiology बिल्कुल normal होगी और यहाँ पे क्या होगी beaded appearance होगी. Please, if you want to write it down, you can write it somewhere on your notes that beaded appearance of radiology is very characteristic of sclerosing cholangitis until proven otherwise. Okay, then this table is over here. You will get this lecture, although it is also there in the problems. So basically, this is the mnemonic for the to remember acute acetaminophen. So I have just shared it to के acute liver failure के साथ patient आ रहा है. Acetaminophen will be on the top. ठीक है, drugs में किसी drug का नाम नहीं याद हो, please acetaminophen याद रखिएगा. Overdoses में और with if taken with a suicidal objective, this is something which is frequently taken. ठीक है, hepatitis A and autoimmune hepatitis B for hepatitis B, hepatitis C. Okay, then it goes on like this. You can go it by yourself. So basically, this is the end of the lecture over here, and now I want to see कि अगर आप इनके थोड़े लोगों के mic unmute करते हैं, and I get the feedback. Those who want to leave can leave, but I want the feedback from those who want to give. जी.
स्टूडेंट्स आप अपना हैंड रेज कर सकते हैं.
अच्छा, ठीक है. आप इनके माइक किसका उससे नाम का सीआर कौन था? सीआर इज आई थिंक रोल नंबर 75. रोल नंबर 75 को अनम्यूट करेंगे हम.
ओके, शहरियार अपना माइक अनम्यूट करें प्लीज.
अस्सलाम वालेकुम मिस. हेलो.
हेलो जी, अस्सलाम वालेकुम शहरियार.
वालेकुम अस्सलाम.
अच्छा शहरियार, ये बताएं कि have you and others gone through the first this serological markers of hepatitis B, serum markers of hepatitis B?
मिस आपकी आवाज क्लियर नहीं आई, एक दफा फिर से रिपीट कर दें.
मैं आपसे पूछ रही हूँ कि आपने सीरम मार्कर्स किए हैं ऑफ हेपेटाइटिस बी, यू एंड द अदर क्लास?
बुक से रीड या मिस लेक्चर की बात कर रही हैं आप?
नहीं, बुक से रीड.
बुक से रीड मिस मैंने तो पर्सनली रीड नहीं किया अभी तक. बाकी क्लास का नहीं पता मुझे.
आपकी क्लास का नहीं पता. अच्छा, आपको सीरम मार्कर्स आज मैंने रिपीट किए थे, समझ में आए?
यस मिस, वो आपने ये बताया था कि जिसमें आपको ये
अच्छा शहरियार,
राइट लेफ्ट साइड वाला एक्यूट है एंड राइट साइड वाला क्रॉनिक है, और फिर इसके अंदर आपने
अच्छा चलो शहरियार, एक सेकंड. आई थिंक वी कैन गो टू समवन एल्स. लाइक प्लीज रोल नंबर 31 को अनम्यूट करेंगे.
ओके मैम. 31 अपना माइक अनम्यूट करें प्लीज.
सॉरी. जी 31. May I know your name please today? Okay, please, who is roll number 31? Hello, who is roll number 31?
शहरियार आप बता सकते हैं 31 रोल नंबर.
बस सॉरी, क्या कह रहे हैं? I think mic issue. Who is roll number 31? Okay, randomly roll number 35. Unmute 35.
ओके मैम. 35 अपना माइक अनम्यूट कीजिए प्लीज।
अस्सलाम वालेकुम मैम।
वालेकुम अस्सलाम। सॉरी बेटे, आपका नाम?
कोमल।
कोमल। अच्छा कोमल, मुझे प्लीज ये बताएंगे कि डिड यू गेट एन आइडिया ऑफ व्हाट आर द डिफरेंट सीरम मार्कर्स फॉर हेपेटाइटिस बी?
For what?
Did you get an idea about the serum markers of hepatitis B?
Yes ma'am, yes ma'am.
Okay. So if I ask you a question that which antibody will be positive in the window period, so what will be the answer?
Ma'am, it would be window period में HBS AC AG.
HB?
No, window period में ma'am, window period में anti HBC is positive.
Anti-HBC. It is basically IgM anti-HBC. Okay.
Yes.
This, have you gone through the serum markers from the Robbins by yourself?
Yes. Yes, ma'am.
What is your comment about the lecture? Are you getting the lectures? Do you understand what is being taught?
Yes, ma'am. Yes, ma'am. I got it.
Okay, or you just want to get rid of it? Okay, randomly मैं किसी और का mic unmute कराती हूँ. Wasim, please roll number 40 को unmute करेंगे.
Okay.
You can randomly go otherwise.
रोल नंबर 40 अपना माइक अनम्यूट करो।
जी कर दिया।
Okay, बेटे आपका नाम?
मनाहिल तारिक।
मनाहिल तारिक। अच्छा मनाहिल, मुझे ये बताएं कि if a patient come to you in the OPD with the symptoms of jaundice and you just want to check that the acute infection is and you're suspecting hepatitis B infection, which markers would you like to do?
For acute infection?
Yes. The patient has come to you in the OPD with jaundice and you want to check that the patient is having acute or active infection, which markers would you do?
We would check HBE antigen.
Yes.
And
which
we
is
would
the
check
most एक minute, which is the most common one?
most common HBS surface
Yes.
antigen.
Always speak HBS first. S stands for surface antigen.
Surface antigen, yeah.
पूरा बोली hepatitis B surface antigen. Please speak up again.
Hepatitis B surface antigen.
Shabash. And what are the markers?
And hepatitis E antigen.
Good. And hepatitis?
And hepatitis viral DNA.
Yes, perfect. So these three markers, the screen is on this. These three markers are elevated. And what we see over here, I'm just emphasizing it again and again so everybody will get it, that if patient is not recovering and entering into chronic hepatitis, again repeat, if patient is not coming out of the acute infection and having a chronic infection, so basically these markers remain elevated. ठीक है, वो कहेगा कि मुझे ये 8 हफ्ते की बजाय 3 महीने हो गए आप सीरम में ये मार्कर्स चेक कर रहे हैं, तो इसका मतलब है कि हेपेटाइटिस बी उसको कंटिन्यू है. ओके, चलें, गुड. ओके, देन नाउ वी गो टू समवन एल्स. वसीम, प्लीज आप रोल नंबर 80 का माइक अनम्यूट करेंगे.
ओके, अनम्यूटेड.
अनम्यूटेड जी. रोल नंबर 80. रोल नंबर 80. Roll number 80, are you there? I have just marked the attendance in left. Roll number 80. Roll number 80. If you have a problem with the mic, you can write your answer in the chat box. Okay, who's roll number 80? No, Wasim, roll number 85.
Okay. एटी 5 अपना माइक अनम्यूट करें.
आपको पता है कि जूम में इनका आगे स्केड्यूल है या दिस इज द लास्ट क्लास?
मैम हमारे पास इसी वीक का टाइम टेबल है सिर्फ.
नहीं नहीं, ये अभी आज के दिन में ये लास्ट क्लास है और देयर इज अनदर
इनकी
क्लास.
देयर इज अनदर क्लास. जी इसकी है मैम
Okay, then
12:45 पे क्लास.
okay, then we should, I think, sorry, कितने बजे क्लास है?
मैम 12:45 पे.
अच्छा, लेकिन आई थिंक ये जी
Hello,
हमारा टाइम
ma'am, I'm roll number 80.
जी रोल नंबर 80. बेटा ये मुझे बताएं कि आप जो है अगर मेरे पास एक पेशेंट है जो जिसको वायरल हेपेटाइटिस बी हुआ था एंड आई वांट टू चेक दैट पेशेंट हैज कंप्लीटली कम आउट ऑफ द infection, which test I should do? I repeat the
Hepatitis
question.
S, hepatitis surface antibody.
Anti-hepatitis B surface antibody. ठीक है,
Surface
दोबारा
antibody.
बोलें कौन सी एंटीबॉडी करेंगे?
Anti-hepatitis surface antibody.
Anti-hepatitis surface antibody. Okay. Another question, that if the patient has come to me and said that कि मुझे jaundice हुआ था, मेरे serum marker surface antigen हुआ, that was positive. Now when I did surface antigen, it is positive. Anti-hepatitis B surface antigen is negative, but surface antibody has not yet appeared in the serum. तो कौन सा टेस्ट है जो मैं कर सकती हूँ टू चेक कि इसको हेपेटाइटिस बी का इन्फेक्शन हुआ था एंड द पेशेंट इज कमिंग आउट ऑफ इन्फेक्शन, या जिसको आप विंडो पीरियड कह लें. विंडो पीरियड ये होता है कि बेसिकली सरफेस एंटीजन, आई एम अगेन रिपीटिंग द सेम, so everybody get it, कि hepatitis B surface antigen has disappeared from the serum and hepatitis surface antibody has not yet appeared in the serum. इस पीरियड को हम कहते हैं विंडो पीरियड. अब विंडो पीरियड में हम कौन सा टेस्ट करते हैं to check that the patient has suffered from anti-hepatitis B, from hepatitis B?
Ma'am, we can check hepatitis core antibody.
Core
IG,
antibody.
IgM.
So IG, it is basically, when you start from here, it is IgM, anti-hepatitis B core antibody. Okay, and if I say that if I have done anti-hepatitis B antigen, so what does the presence of anti-hepatitis B antigen indicate?
The infection is active.
The infection is active, or the antibody is start the levels when it peaks. You can see over here when there is a peak of anti-hepatitis B antibody, these markers of viral replication have stopped. ठीक है, so अगर anti-hepatitis B antibody आपको raised मिलती है तो इसका मतलब होता है कि acute infection हुआ था but patient has come out of that infection. Okay, so if you just concentrate on the graph, what is it, the anti-hepatitis B का जब peak है तो इसकी ये markers who are actually indicative of viral replication have stopped. Did you get this point?
Okay. Yes.
Did you get it? If you don't, if you have any problem, you can ask me again, and you. But first, go to the Robbins and go through it. ठीक है? BE antibody का peak उस वक्त आता है जब viral के the presence of high levels of anti-hepatitis BE antibody indicate that the acute infection has occurred and the patient is trying to come out of that infection. ठीक है? Viral replication stop हो गई है. Or what does this prolonged presence of hepatitis B antigen, DNA or hepatitis B surface antigen indicate? Like एक patient को अगर jaundice है 3-4 महीने से and there is rise in the level of hepatitis B surface antigen, hepatitis B virus DNA and hepatitis B antigen. What does this indicate?
It indicates the patient is going to a chronic stage.
Yes, it's going to chronic state because the markers of viral replication are still elevated. So I don't know your name. What was your name? Sorry, I forgot.
Suleiman Ayub.
Suleiman. Suleiman, can you tell me what is your opinion about the lectures? Do you find them helpful, or do you find that less knowledge should be shared or more detail should be shared?
I find it helpful, ma'am. और सब like
Sorry?
एक ही topic समझा रहे हैं तो it's quite helpful.
No, it is quite helpful, but do you want that more detail should be shared or less detail should be shared?
No, details are okay, I think.
I think we can leave the meeting room now.
Okay, ma'am. Thank you so much. Thank you.
Thank you.
Thank you so much.